A total hip replacement with anterior approach typically comes with a few precautions that you'll want to adhere to in order to avoid a complication. Here's a few activities that you'll need to avoid for the first 6 weeks. The first precaution is no straight leg raises for 2 reasons. The first reason is that during an anterior approach, the incision is roughly between the hip flexors and the hip abductors. Even though the muscles are not cut, they are pulled out of the way to access the hip joint, so they get very stretched. So if you're doing multiple repetitions of straight leg raises, you're really going to aggravate those muscles, causing more pain and inflammation. The second reason, and most important, is that the metal shaft of the hardware inserted into the femur needs a good 6 weeks for the bone to fuse to it before it can tolerate the force needed for straight leg raises. The metal shaft has a textured surface, so as the bone heals, it grows into the texture of the metal. If you do straight leg raises as part of your therapy too soon, you might make that femoral shaft wobble just enough to where the bone has more difficulty fusing to it. I think your hip would fire off some warning shots in the form of pain to tell you that it's a bad idea, but some people want to start these exercises way too soon because they're not having much pain and they want to try to strengthen the hip as soon as they can. But if you do, you can interfere with the healing process, so give yourself time for that good foundation of healing to take place. That's also why we want you to avoid things like riding a real bike or a rowing machine, treadmill, or any type of sport like tennis before the first 6 weeks, because you need a certain amount of healing before it will tolerate that force. The next precaution is no forceful hyperextension. Examples of this movement would be like a lunging position or certain yoga poses where your knee goes behind your hip. And again, this motion is typically going to be too painful, but if you do too much of a forceful hyperextension, that can cause the hip to dislocate because the front of the hip has not had enough time to heal before 6 weeks to tolerate this motion. Forceful hyperextension pushes the ball of the femur forward in the socket, and that can cause a dislocation because the tissue on the front may still be too weak to stabilize the joint under extreme movements. There is a little bit of normal hyperextension when you walk, but that's nowhere near enough force to cause any problems, so a normal amount of extension is fine. Also, avoid any type of positioning or workout that puts a lot of stress on the front of the hip, such as push-ups, planks, or similar core exercises where you put a lot of stress on the hip. Those types of activities can also result in a complication like maybe a dislocation or just overworking those muscles before they have a chance to heal. During the first 6 weeks, if you decide to do an upper body workout at home or at the gym, stick with machines and cable exercises. Avoid free weights for now. I do not recommend any gym exercises for the lower body outside of what we have prescribed for you in the first 2 phases. It's hard to mess this up, but it can be done. Be patient. Give yourself some time to heal. You'll be able to add so much more activity back into your routine after 6 weeks. Give yourself permission to take things slowly, and you'll set yourself up for better success in the long run.